No. Okay dah. Lab, mali ang slide. Okay. So hello everyone. So today I'm going to tackle about the development of common terminology for nursing practice in Europe. So in Belgium, undoubtedly, is the European country made nursing care most visible and where early on the contribution of nursing care in healthcare has been acknowledged by national level policymaker. So in 1988, it is mandatory for all hospitals in the country to collect data 4 times per year using the Belgian Nursing Minimum Data Set, or BNMDS. So the NMDS, or Nursing Minimum Data Set, consists of 23 nursing interventions, medical diagnosis, patient demographics, nursing variables, and institutional characteristics. So in the Netherlands, a nursing information reference model, or NIRM. So it has been developed to accommodate both the information needs of nurses at the clinical level and for aggregating data at higher level. So the model identifies a base level of patient data, a second level of interpretations and decisions by the nurse, including nursing diagnosis, interventions, and outcomes, a third level of aggregated data of nursing diagnosis, interventions, and outcomes for institutional purposes, and a fourth level of information aggregated for international sharing. So nurses in Denmark were early pioneers in the development of common terminology and informatics in Europe. So Danish nurses initiated the joint project Telenurs within the EU to promote a standardization of nursing data and electronic health records. So this project was later linked to the International Council of Nurses, or ICN, project for development of an international classification for nursing practice. In Sweden, it became mandatory for nurses to keep the patient record in 1986, which sparked local efforts to apply the nursing process for recording. So Swedish nurses have been legally compelled to keep the patient record since 1986. So this obligation has been specified to embrace an assessment of the patient's previous and current status. Nursing diagnosis goals, a nursing care plan with prioritized nursing interventions, notes on the implementation of care, evaluation of care, and discharge notes. Additionally, it is accountability of nursing care, nurses also to record medical assessments and interventions for which they are responsible. So next is the WIPS, or Well-Being, Integrity, Prevention, and Safety Model. So it was developed with the purpose of conceptualizing the essential elements of nursing care, clarifying and facilitating systematic thinking and nursing recording. Next is the International Council of Nurses, or ICN. So this is one of the example of organizations working in some areas of nursing informatics. So a federation of more than 130 national nurses associations, or NNAS, representing the more than 20 million nurses worldwide. Founded in 1899, ICN, or International Council of Nurses, is the world's first and widest reaching international organization for health professionals. So now for the concept and process modeling. So in Sweden, one model care is called the SAMBA model, or Structured Architecture for Medical Business Activities. So SAMBA has been a project with the Commission to identify and describe a common main process in healthcare with defined concepts. So this work has led to a common general basic model for healthcare. Now, there is a need for a common model as the basis for the continued work with development of standards in healthcare. Standards are necessary to promote the quality work with systematic comparisons. So for more adequate initiative to increase the competence of the employees, and last but not the least, as the basis to develop well-functioning IT support in healthcare with systems able to communicate with each other. So for the mission, this is to develop a process model for the workflow of Swedish healthcare when dealing with one individual subject of care. So the work has included analysis of process models previously developed by several Swedish counties. It was evident that it is difficult to create a uniform model corresponding to the lot of variants which the former models provided. So next is the model was divided into three parts. So we have, and these are the core process, management process, and communication process. So core process, it is the clinical process and the healthcare. And management process, which monitors and evaluates the clinical process based on the mandate to provide healthcare. And the last is we have communication process. So this is dealing with information and interaction with the surrounding world as document or messages. And that would be all. Thank you.